Using sterile technique, remove the instrument from the package. To avoid damage, do not flip the instrument into the sterile field. Improved packaging design and grip surfaces facilitate the process. Open the device by rotating the adjusting knob counterclockwise and carefully remove the accessory tray. If the green ancillary trocar tip is to be used during the procedure, ensure that it remains in the sterile field. Remove the anvil and retract the trocar fully by rotating the adjusting knob clockwise. The green ancillary trocar is attached to the anvil. After the gastrotomy has been created, the anvil is inserted. It is then brought through the anterior wall of the stomach in the location of the gastric pouch. The pouch is completed and the gastrotomy is closed using an echelon endocutter. Using a grasper, the ancillary trocar tip is removed by simultaneously rotating and pulling straight back. The ILS is inserted into the jejunum and the trocar is extended through the antimesenteric border. The roux limb is brought up to the pouch and the anvil is connected to the stapler. The device is closed until, in the surgeon's judgment, the tissue is adequately compressed for a proper anastomosis. Prior to firing, wait 15 seconds, then make any adjustments required to ensure appropriate tissue compression is achieved. To fire the device, the red safety is removed and the firing trigger is squeezed with a firm, steady pressure. The device will provide audible and tactile feedback through the breakaway washer, indicating the firing sequence has been completed. The orange indicator must be entirely within the green area of the tissue compression scale. Return the red safety to the locked position. Release the device from the anastomosis by turning the adjusting knob counterclockwise 1/2 to 3/4 of a turn. Opening the device further may create a vacuum-like effect and make removal difficult. Rotate the device gently back and forth and apply rearward traction to remove from the anastomosis. To inspect the integrity of the donuts, a surgical instrument can be used to carefully remove them from the staple casing. For complete details and instructions for use, please read the IFU.